Hi everyone, my name's Kristen. I'm going to introduce our policy. We're doing the Mental Health Services Act. It's by Chris Marie, Kristen, Jennifer, Ashley, and Tapasum.
This is Ashley presenting the background. The topic of interest is mental illness and how the Mental Health Services Act of 2004 has been affecting this issue. Mental illness includes changes in thinking, emotions, or behavior, as well as productivity levels, relationships with other people, and daily functions in work, school, or family activities. It is so common that 1 in 5 adults in the U.S. experience some type of mental illness. Among the many who were disadvantaged, there were some groups that needed further intervention, such as American Indians and Alaska Natives, biracial Californians, sexual minorities, and single head of household. With many adults and children not receiving the necessary treatment to reduce these mental illness conditions, there are potential consequences that may occur. The serious consequences of leaving mental illness untreated could result in illnesses such as bipolar disorder and schizophrenia. There are many different mental illnesses and types within each category, and people may not know that these conditions fall under the mental illness category, such as severe depression, panic attacks, dementia, eating disorder, alcohol, and drug addiction. Due to the lack of knowledge, there are misunderstandings and stigmatizing opinions on mental illness, and many are discriminated against. People tend to think that those with mental illnesses are violent or dangerous, but don't realize that they are ill and need assistance. The issue is that these illnesses are not being addressed correctly, and people still do not understand the parameters of mental illness. According to research, being able to identify early and starting an intervention program can prevent mental health crises. Prior to the passage of the Mental Health Services Act, the amount of people who received at least one service during a year was 36.2% in children, 51.3% in adults, and 50.4% in older adults. Aside from those actually being able to receive treatment, the funding for mental health programs was insufficient. Prior to the enactment of the MHSA, California had to make an immense decision by cutting back on its services in state hospitals that served individuals with severe mental illnesses. During this time leading up to the MHSA, funding for mental health programs during 2004 to 2005 were $255 million. There was a need to change how people considered mental health, and its importance was something that many mental health advocates and lobbyists sought to improve.
Hey everyone, this is Chris Murray, and I'm going to present policy and enactment. The Mental Health Service Act was passed on November 2nd, 2004, and became a law on January 1st, 2005, in the state of California. The act was identified as Proposition 63, its purpose being to change the mental health service system in the state of California for all populations, especially the underserved. In order to this act proposed that funds should be provided by implementing a 1% tax on individuals whose annual income exceeded 1 million yearly. The act consisted of five major components that included community services and support, prevention and early intervention, innovation, capital facilities and technological needs, and lastly workforces, education, and training. The Act is still currently in effect and continues to promote a system of recovery and wellness in individuals with mental illnesses since 2005. For funds to be received by the various counties in the state of California, each county must develop and submit a 3-year plan. The funding looks at three areas that are the following: fulfillment of initial plans, 3-year plans, and long-term strategies. Currently, there has been continuous revising of the policy due to unused Mental Health Services Act funding. According to the Mental Health Services Act, the policy was originally created to provide the state with unused county funding after 3 years in order to provide funding for counties who needed it. This is why budget-related legislation has made numerous changes to the policy in order to control the number of counties living with large balances. An example of such changes include counties submitting plans by July 1st, 2020 on how they will spend the current balances of unused funding.
Hi, this is Tabasum and I'm presenting the enforcement. The Mental Health Service Act Proposition 63 was written by Assemblyman Darrell Sternberg and mental health lobbyists. The Mental Health Service Act created the Mental Health Service Oversight and Accountability Commissions, which is the primary enforcement agency for funding mental health programs. This commission is in charge of approving country implementation plans that are part of the requirement for receiving funding. It also focused on at least two people with several mental illness in the family and numerous other community representatives. This agency is reinforced by the California State Department of Mental Health, which approved the 3-year implementation plans submitted by the countries. In order to receive funding, the countries have to cooperate with citizens and stakeholders to develop better implementation plans. The countries cooperate with different community stakeholders in order to understand the Mental Health Service Act's idea of recovery and wellness. If this policy was not enforced, there would have been a lot of financial consequences considering the individual countries would have seen a cut in their funding. This cut in funding would result in people not being able to access appropriate treatment for their mental health.
Hi everyone, my name is Jennifer Nieto and I will be presenting the outcomes. So, since the implementation of the Mental Health Service Act, there has been an increase in funding for mental health programs, as well as increase in mental health services accessibility. An important outcome generated from the Mental Health Service Act was the fact that funding had significantly increased for years to follow after the act was passed in 2004. During 2004 to 2005, the collected revenues from the imposed tax of 1% of Californians who earned more than $1 million a year was $254 million. Looking at the data from 2017 to 2018, the estimated funding revenue is approximately $1.889 billion. This was a vast improvement to when the Mental Health Service Act was first implemented, allowing them to provide more funding for mental health services. In regards to treatment rates, data collected from 2011 to 2012 display treatment rates have increased to 54.5% in children, 62.9% in adults, and 67.6% in elderly. These percentage increases have grown significantly, but most importantly for the youth population. The initial data prior to the Mental Health Services Act suggested that only about 36.2% of children were able to receive treatment, and in 2011 to 2012, the percentage rose to 54.5%. These increases in percentages are also seen as a significant benefit from the passage of the Mental Health Services Act and the revenue generated from the income tax on the extremely wealthy. Some of the unexpected outcomes from the implementation of the Mental Health Services Act were lower rates in homelessness, incarceration, arrests, emergency rooms, the placement of children out of their home, and difficult life situations. The reports produced by Steinberg Institute, along with the County Behavioral Health Directors Association, reported that during the 2013-2014 year, people who received mental health services from programs funded by the Mental Services Health Act went through life-changing results. These results included homelessness decreasing to 58% within the first year of FSP, and after 2 years there was a decrease of 68%. Mental health emergencies also decreased by 89% among children and 90% among adults. Reduced psychiatric hospitalizations decreased by 57% in youth, 51% in older adults. Arrests among youth declined by 86% as well as among adults. That was 91%. The number of incarcerations also decreased among youth by 49% 58% among adults, and 75% among older adults. All of these unexpected outcomes have just shown how funding of the mental health services programs have benefited these various health topic areas.
Hi everyone, my name is Kristen. I'll be discussing the conclusion. The Mental Health Services Act has proven to be quite effective, and its strengths are seen in the outcomes from more funding as well as better accessibility for mental health treatment options. The funding process for the mental health programs has gained so much momentum and generated more funds than each previous year. From the first year of implementation from 2004 to 2005, there was revenue generated to be $254 million. Looking at estimated present data from 2017 to 2018, suggested data for 2017 to 2018 is suggested to be $1.889 billion. Another great aspect about the Mental Health Services Act is the accessibility it provides for specific groups such as Native American and Alaska Natives and other various biracial minorities residing in California. Some potential weaknesses of the policy, though, are the ways that data are collected as well as the distribution of funds within the counties. California is one of the biggest states in the country, and collecting mass data cannot come with some form of errors. There are some large server reports that are trying to be implemented, but the ways that data are received are not completely consistent and are quite costly for the agency to produce. Another weakness for this policy is finding ways to distribute the funds amongst the counties appropriately. There are modifications that continue to pass from California legislation to try and fix these issues, such as the full services partnerships. One of the take-home messages is the stigma of mental health/illness, and that people are said to be violent, along with other negative connotations, but it is usually quite the opposite. The second message being the cost of services, and that many people were not able to afford their services because the Department of Mental Health did not have enough funding prior to implementation of this act. The following two slides are the list of references we used for our project.